I think many of you have heard of Pervitin. There is a belief that the soldiers of the Wehrmacht were all on drugs. But how did things stand with the Nazis' top management? I welcome everyone. Today we will talk about whether Nazi number 2 was a vicious drug addict, or if his addiction was just exaggerated by the media. What drugs did Hermann Göring take, and how did Hitler react to his closest associate's addiction? The history of Göring's drug addiction dates back to the Beer Hall Putsch, an attempted government coup organized in November 1923. During the fighting, Göring received a serious injury, according to some reports in the thigh and others in the lower abdomen. Stormtroopers took the injured Hermann to the house of a Jewish merchant whose wife provided him with first aid. She and her sister took care of Hermann until darkness. Closer to nightfall, Göring was secretly transferred to a clinic to a friend professor. There came the wife of the future Reich Marshal. There she learned that Göring had received serious injuries and faced arrest. Therefore, they urgently tried to get him out of Germany. Göring was in terrible condition. He was plagued by terrible pain. Then he had an X-ray and found clothing particles, dirt from the street, and other consequences of the shooting. According to his wife, Hermann would cry and then describe in detail his terrible pain. When he attempted to escape to Austria, Göring was arrested. Only on the second attempt was he finally able to be taken to Innsbruck. It is from there that the story of Göring's morphine addiction begins. He was given 2 injections every day, despite the fact that a month had passed since the injury. Göring was still experiencing severe pain. Meanwhile, he continued to be given morphine injections every day. Gradually, Hermann could no longer imagine a day without injections. In the spring of 1925, he and his wife came to Stockholm, where it became clear that he had become a true drug addict. Initially, he took only 2 morphine injections a day, but over time, as he became more depressed from the lack of work and hearing about the defeat of the Nazis in Germany, Hermann gradually began to increase the number of injections. At first, he made 4 injections a day, and then 6. It became clear that morphine was needed not only for pain in his leg. The situation was made worse by the fact that Göring had an allergy to morphine, and only large doses could help with the pain. If he took a small dose, he would have episodes of anger, insomnia, and nervous breakdowns. In the end, it was decided to send him to a hospital for treatment of addiction. But the hospital doctors did not even suspect the doses that Göring was taking. According to the treatment plan, it was planned to gradually reduce the dose of morphine. But in fact, it turned out that Hermann had completely stopped using drugs. He begged the staff to give him morphine, and when he got a negative answer, he attacked the hospital staff. After that incident, he was placed in a padded room where he experienced severe withdrawal for several days. At the time, doctors were convinced that the best treatment for addiction was a sudden isolation of the patient from drugs. Many, of course, couldn't handle such treatment, but Göring managed. The psychiatrist who examined Hermann came to the conclusion that Göring was just a sentimental person, lacking in willpower. He wrote this diagnosis after Göring had already been without drugs for 3 months and was discharged from the hospital. And there's nothing surprising about the fact that after some time, Göring started using drugs again and ended up in the hospital once more. It has been another 2 months, and Göring seems to have recovered from his addiction. However, by this point, his appearance has changed. He has become quite overweight, or the wound in his lower abdomen caused a disruption in metabolism. Or maybe it was both the morphine or other drugs. Remembering what happened to him in the psychiatric hospital, he feared becoming addicted to new drugs, and tried to limit their use. Unfortunately, there is no specific data on what drugs Göring was taking before 1937, but after his wife died, the situation worsened. In 1937, during a stay in a sauna, Hermann talked on the phone with Hitler for 2 hours. During such conversations, he forbade anyone to approach him, so it is not surprising that he fell ill. Soon, he began to suffer from tooth and jaw pain and went to a doctor who, after thinking for a short time, prescribed him painkillers. As you have already guessed, the medication contained morphine. The dentist told Göring to take 2 tablets every 2 hours, and this, as you can imagine, led to a new addiction. By the end of 1939, Göring was already taking 10 tablets a day. Of course, this was not as large a proportion of morphine as before. However, the intake of tablets became a habit for Göring. Of course, his addiction to drugs was no secret. They were known in the Gestapo and in the upper management, and the officers always teased Göring. Often, during meetings, as the effect weakened, Göring would leave for a couple of minutes, after which he returned in full spirits. This is what Oberst Wolfgang Falk wrote about it. Göring looked like a completely different person, as if he had been born again. In his blue eyes sparkled sparks, and the difference between the first and second parts of the meeting was striking. For me, it was obvious that he was taking some stimulating drug. It was obvious to Hitler as well, who at the end of the war in anger accused Göring of the collapse of aviation and corruption. Göring's addiction was finally cured only during his imprisonment. According to the memories of American Colonel Bertrand Andrews, when Göring arrived at him in Mottendorf, he looked more like a drug dealer than a leader of the Reich. This was a foolish grinning man with 2 suitcases of pills. But psychiatrist Douglas Kelly cured him of the pills. After all, the stories of Göring's terrible drug addiction, he was surprised by the weakness of the drug that Göring was taking at the time. Kelly concluded that Göring was taking pills out of habit, as if he were smoking cigarettes. Göring did not get any special stimulation from the pills, but they helped him to numb the pain in his legs. Kelly cured Göring gradually by decreasing his dose until he stopped giving him pills altogether, and Kelly cured him more psychologically, playing on his strengths and weaknesses. But as is known, shortly before his execution, Göring committed suicide, although many of his surroundings noted that his mind had become clearer and more sober. Thus, speaking in defense of Göring, he was not a malicious drug addict, at least towards the end of his life.